Yeah, I think there are so many things really I can talk about the BabyGel project because I mean it's one of those big projects around that has come around Mbale, and not only have we had a lot of benefits in terms of the trial activities, but also the non-trial aspect of the study. um, I can say that the biggest highlight really has been helping us to know whether the alcohol-based hand rub actually can work in the communities, and we found out that uh, the alcohol-based hand rub, in terms of preventing infections, in general, it works as well, or probably not better than the usual hand washing and using water and soap in the community to prevent infections. So the baby gel trial has been quite important, not only for us, the researchers, but also for the community and the staff that we worked with, the field staff that we worked in. I can say that one of the biggest benefits is the findings of the trial, because the aim of the trial was to determine whether, if we provide alcohol-based hand rub to women at their homes and they use it before touching their babies. These are women who had just given birth to newborn babies, so we gave them the alcohol-based hand rub to use it at home before touching their babies. Not only them, but even their other household members, for them to use it before touching their babies. And the question was, would this help to prevent infections in these newborn babies? And yes, we're excited at the end of the study to really know what the results were. And yeah, one thing that was a surprise is that there was no difference actually between the mothers who got the alcohol-based hand rub and those who did not get alcohol-based hand rub. And the questions were, why is this the case? Because yeah, we thought maybe alcohol-based hand rub was going to work. And some of the things we think is that yeah, maybe the mothers already have a stable microbiome or microbiological environment, and the alcohol-based hand rub may not necessarily help to prevent that, and also maybe the soap and water that they're using works as well as the alcohol-based hand rub, and those are the things we're thinking about. And I think this is very important. It's a very important finding. To really appreciate that yes, whatever the environment that the women are living in is probably already stable enough, and maybe the alcohol-based hand rub works better in places like the hospitals, where the babies and the mothers are not used to their local microbiological environment, and maybe the alcohol-based hand rub works best in those other areas, because for sure we know that alcohol-based hand rub works very well to prevent infections in a hospital setting. Yeah. The community that we worked in were not used to medical research. And it took really a lot of time for us to explain what medical research is. Some of the community leaders, the public health specialists who work at the community level, they really got to understand what research is about. And I believe that the structures that we have built in, the knowledge that they've got about medical research, if any other medical research comes in the community, they'll be able to understand it much better, because people really didn't understand what medical research is about. That's one. Two, there are women who actually, in addition to just participating in the trial, they really have very wonderful stories. These are women who had challenges with their babies. And you remember that in this trial, we're also giving them some help in terms of medical treatment for their babies when they were unwell. Even the women themselves, when they got unwell, we're also giving them treatment. We're buying for them some medications in the health facilities they were staying in. So all these really help the women have a better outcome for their babies. Also, in addition, we're also working with a number of local midwives and nurses and other professionals, and they really had some very nice research skills, moving to the field, collecting data. And I can testify that many of these midwives actually eventually built their career around research. They've got more jobs in research related areas, but also some have gone back to school in the area of research. And this is all because of the base that they found with BabyGel. So those are really quite some strong benefits of the project. And then, yes, we also have PhD students who have done a lot of research in BabyGel. I happen to have been one of the beneficiaries of the project as a PhD student, as well as being a principal investigator of the project. And I mean, the skills that I've built as a researcher, as a young researcher, really are going to be very important in my research career in future, because I plan to move ahead in terms of the neonatal research in newborn babies, but also in other older children, in terms of babies who are born here in Eastern Uganda, but also other parts of the country. So it's really been a very interesting research in terms of the progress. Then we also have a lot of other people who have really testified that because of BabyGel or the trial, they have really been trained. Remember that we also had some computer specialists who are working with us as trial managers. These trial managers also had some really rigorous training in terms of data management with the team from the University of Liverpool. So the local capacity really has been strengthened in this area of Western Uganda. And the capacity that we have built from the PhD students with the clinical research skills, the data scientists who have already have a lot of skills in data science, and the field workers. I mean, that is already enough for us to say that there is going to be some level of sustainability in terms of moving forward in medical research in Bali. Yeah. I can say it has been an honor to work with BabyGel Trio. And one of the things that I've really enjoyed is trying to coordinate a community trial. And previously, I've worked mostly with the studies in the hospital setting, and it's been interesting how, the challenges that have been coming with in the community, dealing with the community, some of the myths and misconceptions, and how we troubleshooted to make sure that the community understands that the study properly. I mean, it was a challenge, but eventually at the end of the day, you felt really good that you were able to make the community understand what is happening with the trial and the rationale of the trial, and also working with so many people in the field. It was one of the most interesting things that I can say that, yeah, I worked with the. Yeah.